was inspired to become a physician real early in life, so I got lucky and knew what I wanted to be when I was 9 years old. My mom had to get a mole removed from her side that was potentially malignant, and the doctor was kind enough to let me watch, and he did an old school open biopsy in the office. And I know it may gross most people out, but I remember very distinctly that when he made an incision and I was actually able to see that there was stuff under our skin, it just sent fireworks off. And I was very interested in learning how we worked as people. And it just took that experience to know that that's what kind of got my motivation working. And ever since then, I've wanted to be a physician. So I thought I wanted to be a dermatologist at first, but then when I got to medical school, I learned that surgery was where my heart was. My education journey, like most doctors, took quite a while. I went to high school here in Carrollton, Georgia at Central High School, and I was lucky enough to know from a very young age that I wanted to be a physician. So I was kind of dedicated along that path early on. Once I graduated high school, went to Athens and got to spend 4 wonderful years attending the University of Georgia. Go Dogs. That was a fun time. And then I went to the Medical College of Georgia. And that's where I actually got my first real exposure to surgery. The hands-on part of medicine, being in the anatomy lab, I learned I really liked to work with my hands in that way. And then I got to see my first surgery, which was actually a kidney transplant. And thankfully I didn't pass out, so I knew that I enjoyed surgery. And after I saw that one procedure, I knew I wanted to be a surgeon. I was lucky enough to match into orthopedic residency in Columbia, South Carolina. I worked at Richland Memorial Hospital with Prisma Health. I was very lucky with that residency. I had very good mentors, very good surgeons coaching me, teaching me along the way. So I spent 5 years there. After I finished my orthopedic residency in Columbia, South Carolina, I was lucky enough to get selected to go do an extra year of hand and upper extremity surgery specialty training in Birmingham, Alabama. And I was able to work with the specialists at the Andrews Institute there, and we treated many athletes, some of which played for the UFL football team there, the Stallions. So that was a really good experience. I got exposure to a wide breadth of upper extremity pathology, including lots of pediatric pathology, peripheral nerve pathology, and then sports-related injuries as well. Working with Piedmont Orthopedics was my first job after training, and that's where I've been ever since. So my areas of expertise include all general orthopedics. I did 5 years of training for general orthopedics, but then did an extra year hand upper extremities. So that includes fingertip to shoulder. I see a lot of finger fractures, wrist fractures, and degenerative diseases such as hand and finger and wrist arthritis. I treat elbow injuries as well, but all the way up to the shoulder. So shoulder pathology, including rotator cuff tears, shoulder arthritis with shoulder replacement. And so all of those things are in my subspecialty training. My approach to patient care communication is to be as personal as possible. I oftentimes tell patients that your relationship with your surgeon is kind of like getting married, right? It's a very big decision. Usually when I do surgery on a patient, that means that they're my patient for life. And so I want to know them very well, and I want them to know me very well. I want them to know what their pathology is, what their disease process is. I want to make sure I've answered all their questions. I want to make sure that I've explained to them all their treatment options, and make sure that they feel comfortable with their depth of knowledge on their disorder. So as long as they're comfortable, then I'm comfortable. A lot of times I tell my patients, if you like it, I love it. And that way, once they're comfortable, that allows us to move forward. And so my real approach is just being as open and as communicative as possible so that all their questions are answered. And once they feel comfortable, that's when we move forward with a treatment plan. Along with that communication and that tight relationship that you're oftentimes able to develop with your patients is that you become friends. And so I've had some very kind things done for me by my patients, one of which is this pen. One of my patients makes these pens. It's a handcrafted pen made out of mahogany, and he was unable to do that due to hand arthritis. And so we did surgery and got him back to making pens, and out of his thankfulness, he made this pen for me. So I use this every day now, and I'm really appreciative of that. And I know he is too. One of the things I enjoy most about interacting with my patients and serving them as their surgeon is getting them back to the level of activity that they want to have. Doing general orthopedics, I'm able to get people mobile, but as a hand and upper extremity specialist, giving someone their hands back is very rewarding. Our hands are what we use to interact with the world around us. It's how we learn when we're kids. It's how we accomplish many of our goals and tasks throughout the day. So when a patient comes in that's unable to do that because they have an issue with their hands and I'm able to give them their hands back, it's very rewarding for me. So medicine usually takes up a lot of your time, but when I'm not being Dr. Hightower, I get to just be Cody Hightower. Some of the hobbies I enjoy the most are hunting, golfing, riding my dirt bike. I grew up being outdoors, and I've been very blessed to live next door to my brother and my parents. My family's close-knit. A lot of these activities we can do together. So anything that I can do to be with my friends and be with my family outside, that's what I like to do. I'm trying to get my 3 daughters into hunting. We'll see how that goes. And then I have a Labrador Retriever that I train as a bird dog, and working with her is really fun. We get to work as a team. So that's one of the reasons I like to hunt as much as I do, is because we do waterfowl hunting, and retrieving her is great. And then, getting to live in the Bremen area, that's something I can do in the surrounding area with some of my friends that live locally in Bremen. So it's been great to be back home and enjoy those things with the people I love. I grew up in Carrollton, Georgia, which is right next to Bremen, Georgia. And so whenever I was able to secure this job with Piedmont Orthopedics, Ortho Atlanta, I was able to move back to Bremen, Georgia, which I tell people I live in my hometown. Not quite true, but very close. Whenever I moved back to Bremen, I was actually able to become the team physician for Bremen High School, and that's been really rewarding for me. I'm able to be there on the sideline with the guys on Friday nights for the home football games. I have a really good relationship with the athletic trainer there, and so being able to serve my community by being the team physician and being involved in that way has been really rewarding. My girls go to Bremen, and so they get to see their dad be the team doc, which makes me feel good and gives them a sense of belonging in the community. Hey, my name is Dr. Cody Hightower. I work with Piedmont Orthopedics in Ortho Atlanta. I'm a general orthopedist with hand and upper extremity specialty training, and I'm here to get you back to the activity level you need to enjoy your life.